Today, I would like to take time on behalf of the Tanzanian partners to acknowledge and celebrate 30 years of partnership and collaboration with Harvard University.
Institutions of higher education have a responsibility to work toward making the world a better place, fairer and more just.
It has been a journey that has touched many of us present here today.
Harvard is fully committed to working with all of its resources to try to achieve those goals, carrying forward research, capacity building.
We have collectively achieved a lot throughout the past 30 years of our collaboration. A number of successful research studies, interventions, and capacity building programs have been undertaken to answer key questions through scientific approaches.
As you can see here, translating that research into practice is what we are all about. It is what you are all about. It is what has made the partnerships at AAPH, at the ARISE Network, a partnership with Heidelberg, for many years, such a success.
This collaboration has extended beyond Tanzania. Through founding of the Africa Research Implementation Science and Education Network, in short ARISE, which now comprises 21 institutions from 9 sub-Saharan African countries.
And the focus really is on 2 aspects, as we always do. We try to advance knowledge by doing research, and we do research on a number of issues. Research on the state of adolescent health, documenting more what is the gap, what are the gaps in health services, in indicators that are important to monitor adolescent health over time. But we also seek to advance the evidence on interventions. This is what makes us unique and makes it really a pleasure for all of us to work together. Adolescents are key to the development of Africa, but really they are also key to the development of the whole world.
In Tanzania, adolescents account for over 12 million, which is equivalent to roughly 20% of the population, and this number is growing. So I'm pleased to see that this scientific symposium aligns with the 6 pillars, and these pillars are preventing HIV, preventing teenage pregnancies, preventing sexual, physical, emotional violence, improving nutrition, keeping boys and girls in school, and developing skills for meaningful economic opportunities. These pillars represent issues that affect adolescents disproportionately and areas where interventions are limited.
And I'm very pleased to see some youth representatives here in the room today.
I would like to emphasize on the engagement, because this is my first big platform to attend on the issues of scientific research and all of that. I've never seen any young person taking the lead in these kind of platforms. Please engage us in a meaningful way.
I believe that your voices, your experiences, and your opinions are just as important as research when it comes to developing adolescent-focused health interventions, especially those that will help us reach HIV epidemic control.
It has been a priority of the 6th government of the United Republic of Tanzania under the astute leadership of Her Excellency President Dr. Samia Suluhu Hassan, who is committed to the improvement of health and well-being of adolescents, recognizing that they are the future generation of Tanzania.
Our success in addressing this issue will impact current and future generations. Pooling our energies and resources to work across institutions and countries, which is the approach taken by the ARISE Network, will most certainly ensure public health improvement when it comes to HIV, nutrition, maternal and child health, and other disease areas.
But looking at this symposium agenda, I'm glad to see that Tanzania locally generated research, including implementation science, are on track to guide the Ministry of Health on how best to deliver health interventions or sustainably scale up some of the promising interventions around nutrition health, as well as HIV reduction among adolescents.
I'd like to thank many partners for the collaboration that we have been advancing together. Partners at the Ministry of Health, many partners in Tanzania, University of Dodoma, I haven't mentioned, Ifakara Health Institute, in addition to MUHAS, MDH, and many others. And our partners in many countries in Africa, in Europe, and beyond. Thank you so much.